माताकून स्वागत करता. आयचे कार्यक्रम सुरू एक मंगलाचरण सांगून स्टार्ट करूया. ओम अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरोन्मिलितं येन तस्मै श्रीगुरुवे नमः. श्रीचैतन्यमनोभीष्टं स्थापितं येन भूतले स्वयं रूप कदा मह्यं ददाति स्वपदान्तिकं. वन्देऽहं श्रीगुरो श्रीयुतपदकमलं श्रीगुरून् वैष्णवांश्च. श्रीरूपं साग्रजातं सहगणा रघुनाथान्वितं तं सजीवं साद्वैतं सावधूतं परिजनसहितं कृष्णचैतन्यदेवं श्रीराधाकृष्णपादान् सहगणा ललिता श्रीविशाखान्वितांश्च. हे कृष्णकरुणा सिन्धो दीनबन्धो जगत्पते गोपेशा गोपिकान्ता राधाकान्त नमोऽस्तुते. तप्तकाञ्चन गौराङ्गी राधे वृन्दावनेश्वरी वृषभानुसुते देवी प्रणमामि हरिप्रिये. वाञ्छाकल्पतरुभ्यश्च कृपासिन्धुभ्य एव च पतितानां पावनेभ्यो वैष्णवेभ्यो नमो नमः. जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर श्रीवासादि गौर भक्तवृंदा. हरे कृष्ण 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 हरे 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 राम 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 हरे हरे. हरे कृष्ण 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 हरे 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 राम 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 हरे हरे. हरे कृष्ण 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 हरे 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 राम 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 हरे हरे. हरे कृष्णा सगळ्यांकय. अपास सगळ्यांकय आईचे कार्यक्रमात स्वागत करता. प्रति फोर्टनाइट चलचे ह्या भागवत पुराण कोंकणीचे युथ सेशनांतू आईचे भारी इंटरेस्टिंग टॉपिक अनेक इंटरेस्टिंग टॉपिक घेऊन आयिल्ली ती. आईचे टॉपिक असं माय MBBS जर्नी म्हणून सांगून स्पीकर असत आईचे टॉपिकाचे भक्तीन अरुंधती नायक हानी तुमक स्वागत करता. तांगे विषय एक सांग परिचय दिवचे हा प्रयत्न करता. भक्तीन अरुंधती नायक हांनी आमक पुरजन चिरपरिचित आशिल्ल्या हर ग्रेस जय गौरांगी माताजी हांगेले ग्रँड डॉटर जावन आसा ती. हांनी हांगेल अन्नाल नाव रवींद्र नायक, हांगेल अम्माल नाव अनुपमा नायक आणि हांनी कॅनरा हायस्कूल उर्वांत शिक्किलेन ती. हांनी आता कणचूर इन्स्टिट्यूट ऑफ मेडिकल सायन्स अँड रिसर्च अंतू इंटर्नशिप करता आसा ती. स्वागत करता. आयच्या टॉपिका विषय उल्लो का म्हणून तुमक निमगून घेता. हरे कृष्णा, ओवर टू यू.
Hare Krishna. तुम सगळ्यांक नमस्कारू. First of all, I'm very grateful and thankful कि म्हाका तुम्ही opportunity दिला to come here and talk about my journey. So, Miguel Amma Anupama Nayak, she's a teacher in Canara High School Urva. आणि Miguel Anu Ravindra Nayak, he's a businessman. आणि हांव जय गौरांगी माताजील नाती. So, म्हाका थोडे दिवस फुट बापा मान सांगताना की you have to choose a topic and speak on it. The first topic that came to my mind was my MBBS journey. Itamala, the amount of learnings, the amount of teachings that this journey has given me, I thought it was the most appropriate topic to start discussing on. So first मेगेल journey म्हणताना मस्जे निमगे ताची की तू का डॉक्टर जाव का म्हणून केन दिसला, तू केन या डिसिजन घेतला आणि तू कसं तुक इन्फ्लुएन्स केला to become a doctor and all of that. Honestly, पोट दुखून एक fascination आशिला about becoming a doctor, about learning about the human body. So आमके 10th ते मस्त उणे शिकायताची. So we only learn की your heart pumps the blood. ज्याला मागता शिकली मागिरी I used to be very keen and very eager. अब घरा वचून I used to start reading more about it की कसला पंप जातस, कशी पंप जातस, what factors influence it. So must san dukunu asil biology of my body was very eager topic for me. So from before Miguel Matan Tashila that I wanted to become a doctor. Tashi, and by God's grace my parents never questioned me ki MBBS score ka va tu kashi karta kashta asa gotas na va wajit nav tu. They never questioned. Tankai gotas ashil ki mag doctor jaw ka. Miguel full family gotas ashila. Bapa ma ka, ajja ka, bappa ka. Everybody knew I wanted to become a doctor and everybody were very appreciative and very welcoming about the fact that I wanted to choose medicine. So एक important point I would like to tell if there are any young students here, की आता 10th स्टुडंट्स निमगे लारी की तुम केद्र वचून कसं शिक्का म्हूण निमगे लारी तांणी म्हणटा की आतां हांव 10th जालें मागीर हांव सायन्स घेता जावं कॉमर्स घेता ताचे मागीर पळोवया कसं म्हणून but that is not how it goes. So to 10th astanachi, you have to make a choice. You have to come to a decision ki tuk edra uchun kasa kor ka म्हणून. That is because at the internet access pura jana kas. It is very important to use that internet in a good way. So if you make a right choice when you're in 10th standard and when you're about to start your career life, it makes half of the things very easy for you. You should either be in the black zone or in the white zone. Never put yourself in the gray zone. Because the clarity and tumgal mind sort out aslari, half of your work is done. 50 of your obstacles are overcome by that thing. So always make a decision. Tumi 10th astanachi. Be firm ki tum kasa kor kamon edra ochunu. And use your internet in a good way. There are plenty of options. Tumgal spectrum must narrow the one getla. That is not how it goes. You should always have your wide spectrum, you should have your spectrum open. Research karyachi. You should spend some time on yourself for yourself because only you know what you are good at. Only you know what you can excel in, and only you know what you are capable of. Tashi, you should make that decision. And if you decision you can always channelize your energy in the right direction. So mak go to shilten tantugi mak doctor jau kamun. So I knew ki maka science घेऊ का. Science and I knew ki mak PCMB, I have to take the biology branch. And PCMB into, I can concentrate more on physics, chemistry, and biology, and not maths. Because obviously maths mak jau ka shilmigel both zaka. But physics, chemistry, biology, these three subjects were the one that could fetch me a neat seat. So first important point is make a right decision, and you have to stick to that decision. Second important point at that time, Ari, what I see the most and what I see in my brothers also is peer influence. Mikkel friends ta college avatta sachi, aveta college avatta. Mikkel friends ya branch geta sachi, aveta branch geta. Unfortunately, it doesn't work out like that. तुम्ही decision केले कुडले तुमक कसं जाव का life अंतु, which college suits that, which branch suits that, which place will suit it. त्या पूरे पडोनु you have to make a decision on what you want to achieve in your life. So that is second one. So first one is make a very firm decision on what you want to achieve. Second one is never be under the peer influence. Third one, Kastamara Miguel, academic was very strong. So mark 10th and to 98% melda. So I got into expert. But getting into expert maybe was a good decision or was a bad decision. Because Kasajal Madari 7 to 7 ashila. And people usually think, oh, he 7 to 7 baista, sir. 7 to 7 questions solve karta, sir. 7 to 7 class aikata, sir, and all of that. But Tashasana, ita Madari. Now that I'm doing medicine, I can realize ki kanche individual attention span will not be more than 3 to 4 hours. 3 to 4 hours, anybody will zone out. It is not very easy to stay attentive. And it has 7 to 7 baistana. It was very difficult. Of course, our expert credits ditta because expert made my concept strong. Expert taught me how to manage time. Expert taught me how to face the world because you are surrounded with so many competitive students there. It pushes you to be motivated and it pushes you to always work hard. So त्या hanto expert credits ditta. So I used to sit 7 to 7 exam class especially 7 o'clock I used to go back home. Magiri freshen up jauche javan korche pura mantana. It used to be bedtime. So I used to go to bed. Next day apas saka no expert avachishila. So somehow this 7 to 7 was not suiting me. Kasajat madari, no matter what competitive exams you're giving, the AIMS aso or NEET aso or JEE aso, engineering aso, kasane aso, self-study is above everything. Because your way of studying, your pace at which you grasp things, the rate at which you are studying, they might be better than you or they might be slower than you. Just because to make a group antasachi, you should not influence your study technique or you should not compromise with your study technique for the sake of others. And tumgel study technique is very, very discreet to yourself. So makata study time melta nashil, self study time melta nashil from when I was in college from 7 to 7. So that was one drawback. Ki maka bai sonu megel kashi vajucha. So always make kya ashila ki a vajil kudle notes korchishila. And exam time ari, I never open my textbooks. I only open my notes and I keep studying from that. Same thing I do in MBBS way. कसं नाही वाचिताना वगी वगी नोट्स करच्या इथं मला एक्झामा टाइमार तू MBBS टेक्स्टबुक ओपन केल्यारी यू आर श्योर टू सिट इन क्राय द होल नाईट सो त्या मेगल स्टडी टेक्निक आशिल्ला बट नोट्स करची सोडी वाजूच टाइम वे म्हाका एक्सपर्ट तू मेळ नाशिल्ला सो that was one drawback that I felt I had after I joined expert. But nevertheless, I was there for 2 years. I studied hard. I worked very, very hard. And मेगल NEET exam आशिल्ला. So NEET is one all India exam that everybody gives to get into any medical college. So मेगल NEET exam jalla. So NEET exam antu I got 440 out of 720, which was not a bad score, but it was not a good score either because ma kanche college antu government seat melna ashila. So when I went and told my parents ki mak doctor jau ka, they never questioned me ki tu kasala doctor jau ka ni म्हणून. But at the same time, megale ek responsibility ashila that getting a medical seat through management or through NRI quota or whatever was not worth it. Tasal doctor jaunu, what is the use? I always wanted a government seat. So yeah, 440 marks antu, it was very difficult. Magotas ashil mag government seat melna. So त्या टाइमारी I would emphasize अनेक pointer that always have a backup plan. तुम्ही एक डिसिजन करताची तो you should stick to that decision. It's going to make your jobs easy. All that is true, but you should always have backup plans. Miguel कसं झालं म्हणारी, I wanted to become a doctor and I only knew about MBBS. आ विंगड कसं नाही विषय थिंक करणी आशिल्ला. There was no alternative in my mind. So म्हाका कळली की म्हाका गव्हर्मेंट सीट मेळना म्हणून. I was very chaotic. I was very low. म्हाका कसं कोरका म्हूण गोत नाशिल्ला, कोणाला उलोवका म्हूण गोत नाशिल्ला. And at that state of mind, तुक विंगड कसं ने find out करची वय जायना. You just are very, very low in life that nothing, you cannot see any possibilities in front of you. So then mak realized that if I had a backup plan, it would have been so much better. Ki I knew I had to repeat my NEET, ta ek ashil option, but also my backup plans and I would have been a little more confident and I would have not been so chaotic in my mind and I would have been able to deal with that situations more nicely. So that is important that तुम्ही decision करताची way, but everything in your life doesn't happen the way you want it to go. So you should always be ready for all the obstacles that the world throws at you. So always have backup plans. Plan B, plan A first korka. Plan A kelari magir you can be ready with plan B or plan C. So that is one more learning that I had. So कसं झालं म्हणारी, I did not get a government seat and it was time for me to go and tell it to my dad की म्हाका government seat मेळ्ळी and I want to repeat one more year. म्हाका एक year drop घेवका आणि म्हाका repeat करका. I was very scared, of course, because I had always been a academically very good student. आणि parents जाला, family ला, friends जाला, पुरा जणाल hopes आशिल्ला. So to go and disclose to them कि I एक वर्ष drop घेता and I want to concentrate and work hard again and then still stick to MBBS was a very challenging thing for me. But to my surprise, the moment I went and told कि Anu makka NEET repeat korka, Miguel marks are not enough for me to get a government seat. The first answer he gave was repeat करतवा, चाहे repeat करी. So I had no problem in communicating with my parents or my grandparents or my relatives in any manner. Relatives, of course, तांणी म्हणटाची की ही बुदंत आशिल्ली, हिन कसला एक वर्ष ड्रॉप केला, कसं सीट मेळ्ळा त्या घेवेत आशिल नवा, विंगड कडेन वचून शिकेत आशिल नवा, विंगड कोर्स घेऊन कोरेत आशिल नवा, and all of that. If you have 200 people supporting you, you have 500 people criticizing you as well. So that is one more thing I learned ki you should learn to filter. Tumko kasa jao ka, whatever is helping you. My family was helping me. My friends were helping me. And that's all that I wanted. I wanted some motivation. I wanted some encouragement. And I was getting that. So, mak farak padne ki Miguel binga relatives kasa manta sachi. Or what are some of my other teachers talking. I had few teachers who were very supportive, who tani malli ki atta time cheredu agotas what they want. So they will take their decisions. The only thing that family, friends, and teachers have to do is support them in whatever decision they take. So त्या हाजेरी I was very lucky. I spoke to my parents. Miguel आज जशील त्यांना. So Miguel आज जान म्हणलेला घाल रे तिका क्लासांत आनीक ती जात पळ डॉक्टर. So unfortunately, he wasn't with us when I became a doctor. So that is a very sad thing. Miguel आज जान असला तर भारी खुश जातशील म्हाका डॉक्टर पळोवन. So so I asked, requested my dad. Miguel Annan, without a second thought, Mark Sangle ki, yes, you can go ahead, give it a shot again. I know you can do it. So our wake words drop getla, our Akash platform adukunu. I started again preparing for my NEET. And this time I got an all India score of 11,000 out of 25 lakh students writing NEET exam. So, and I got a government seat, and that is what I wanted. And I was very happy. My friends, my family, kasane encouragement, motivation through words, through gifts. They were constantly motivating me that 1 year that I took a drop. Taj Mahir, I got into my medical college. I started first day of class abaistana. It was very hard for me also to believe ki, oh my God, itla pura jalla, and I am finally here where I dreamt of, where I worked hard for. Medical college watch push food of course pura research and core nastachi. So I had also watched few Netflix series on how medical college runs, and some YouTube videos on medical college students आणि पुरे. So magotच आशिल्लें की first year अंतू आमकां cadavers दिताची पूण cadavers are basically dead bodies. तुम्ही त्या dead bodies हावेर काम कोण शिकच्या. So I was very excited की medical college first day आणि cadaver पळो येतं म्हणून. It was not as exciting as I thought. मस्त scary आशिल्लें. You had 7, 8 dead bodies lying in front of you, and you had to learn from them. So one interesting thing ashil ki amka first day of my MBBS, we had something called cadaveric oath. So cadaveric oath kasamadari, we take an oath where we promise to the cadavers ki ami tank respect karta chi. We will be grateful for them for teaching us, and we would treat them as one of our own. And the entire year goes, ek body ditachi, and we have to study from head to toe in the same body. So they make groups of 20 people, and each body is given to them, and we study. So that was very fascinating for me in first year. I was like, okay, I made the right decision. And my teachers, Miguel, like biology 10th teachers are Sochi, biology 12th teachers are Sochi, MBBS teachers are Sochi. I was very fortunate. Must like teachers medlichi. So never ki makashi doubt aila did I take the right decision of spending so much efforts on this course. So I was very happy. I got into MBBS and started my first year also. So first year antam 3 subject asucha: anatomy, physiology, and biochemistry. So anatomy basically is to get body, bones, muscles, tissues, taj vishay pura shikcha, khai dukun khai ta muscle batta, ya bone kash kaam karta, and all of that. Then we have physiology. Physiology is basically how your body is functioning. तुका वोंग की जत जाल्यार वोंग की कसला जाता, ताप येता जाल्यार ताप कसला येता. And biochemistry. Biochemistry is all the chemical reactions that occur in your body. So basically, first year and second year AMGL MBBS Antu is very conceptualizing. So that concepts to strong kon getlari, only then you will be able to understand the third year and final year subjects of medicine and treat patients. So first year jalla, very, very not as easy as it sounded. Very difficult. Mast vaju chashila. For the first time, I had heaps of books in front of me. Ek subject acha, 7-8 book, and because it was all of by hearting, first year and second year more of by hearting. So mast books astashil vaju chaka. So it was very new. Megal parents are new. Megal amma ekka kaam ashila. She used to only gather books present everywhere in the house and come and keep them in my room. And exam asmada megal sagle gara kaltashil. Book pura ekade nastashila. And all of that. So MBBS first year jalla, I came into second year. Second year onto more interesting topics. We had microbiology, we have pharmacology, and we had microbiology, pharmacology, and forensic medicine. So microbiology into you learn about all these bacteria, viruses, coronavirus because ami corona batch achashilichi. So we thoroughly had to study about coronavirus. Pharmacology into तुगेल various drugs तू कसं वखद दिता, कसं वखद दिवचाना, chemotherapy कशवत्ता, तसल पुरे. मागीर forensic. The most important and the most fascinating subject for any medical student is forensic medicine. सो आमकां तितलें आसना बिकॉज मेडिसिन म्हणटाना आमी नॉर्मली कसं सर्जरी आसतलें पिडियाट्रिक्स आसतलें ओबीजी आसतलें म्हूण आसता बट फोरेन्सिक मेडिसिन अशी कसं न्ही कोणें उलयनाची बट फोरेन्सिक इज वन ऑफ द मोस्ट इंटरेस्टिंग एंड इंट्रिगिंग टॉपिक्स आमकां पोस्टमॉर्टम्स पळोवच्या मेळ्ळीची फ्रॉम अ व्हेरी ओल्ड मॅन्स पोस्टमॉर्टम टू अ यंग न्यू बॉर्न बेबीज पोस्टमॉर्टम. So we had beautiful experiences in the postmortem, various chemicals, poisoning. So must interesting factors असतात. Bone पळोवन तू कशी एक age आणि sex determine करत. Bone पळोवन तू कश तांगेला time कितले lapse जाला since they are death म्हणून तू determine करत. And when you see somebody who committed a suicide based on the ligature mark, तांगेला hanging a mark पळोवन तू सांगेत की त्यांनी hang केलेल की कोणी विंगडान तांक मारनु hang करयलेला. So there are various very interesting topics in forensic and very practical based. You go to the hospital, you go to the mortuary, you go and assess the dead bodies, you attend the postmortems, you go to courts because must medical legal cases ay astachi. So you can go to the courts and you can with the doctors and you can see ki doctors kashi tangela ya ditachi statement ditachi on certain medical legal cases, all that. So second year jala. So in third year, from third year, we had clinical subjects. So atta me no more students who are sitting in the class. I'm only 1 hour theory classes, lectures, and all the time we used to spend in the hospital with the patients, running around with the doctors, PGs almakshi, nurses almakshi. Honestly, doctors alpashi churd ek medical student al friend nurses because they are the ones who have so much empathy and it's like kind nature because provided you build a good relationship with them. So third year anta megel topic ashil ophthalmology and ENT. So ophthalmology into of course beautiful subject. अशी दोळ्या सर्जरीज पळयत आनी तुमगेल दोळ्या दुखून उद्दा येता. So it is that scary and it is that also very fascinating. So cataract surgeries आसो, eye transplantation आसो, or just a simple dola redness dola कसं की एक injury जल्ला and we have seen patients where dola कसं की जीव गेलेला आशिल्ला and it became so bad that he started bleeding from his eyes. So various interesting factors. ENT into we've seen conditions where some insects together. So we have some insects known as maggots. So the maggots tungel kanna bitari or wherever it basically tries to run away from sunlight. So काही पुढे जाता wherever the dark areas are there in the body थंय त्या वता. So we had maggots in the ear. आणि maggots are such creatures तुमकां कसं नाही घाल न्हू कसं chemical घाल न्हू drug घाल न्हू तांकां काडू जायना. They should be hand picked. So आम्ही forceps घेऊन एक maggots काढलेलं असतं. And then when maggots breed they produce 200 eggs. So तांगेल एक cycle जाली कुडले you can imagine the amount of maggots that was coming out of his ears. So tassel interesting cases. And once you get into hospital, it is all patient based. So one more important thing कि आप कसला doctor jali is because it is a beautiful feeling कि when patients इतले hopeless जाऊन patients इतले sad and इतला low जाऊन hospital येताची, but the same patients the way they look at doctors तांणी एक इतलं hope घेऊन तांणी इतलं खुशीन doctors पळयताची and the respect they give to doctors is incredible. मागीर तांणी वतान इतलं खुशेन वताची and even being medical students तांणी इतला आमकां respect इतलं चंद करून उलयताची. So being there for somebody in their most vulnerable situation is an absolute blessing. And MBBS journey definitely is a difficult one. Maybe तुमका 100 obstacles असतला, 200 challenges असतला, but definitely thrice ताज्यापाशी चड satisfaction असता. So when you go back home and हांव घरकडे येवन अम्मा सांगतान की या surgery आशिल्ला, now she's cured of it. Breast cancer आशिल्ला, she was a very young patient. आता काडली cancer, now she's cured. एक old age, एक old दालमंच आशिल्लो, ताका fracture जालेला. आणि त्यावे ट्रीट केलं. So it's a very beautiful thing to tell ki okay, you're successful in whatever you plan to do, and to be there for your patients is amazing. So ophthalmology, ENT ashila, and one more interesting subject ashil community medicine. Nobody would know ki medicine antu MBBS ant ek subject astala called community medicine. So community medicine is somewhere something that you go into the community, and tangel pura information basically census तांगेल वेरियस इन्फॉर्मेशन. तुम्ही कसं खाताची, तुम्ही कसं पित्ताची, तुम्ही केन्न खाताची, तुम्ही केन्न पित्ताची, तुमगेल घरान तू डेंगी केस असवा, मलेरिया केस असवा. एंड we have Miguel my hospital is near Kerala, so amke ek sana jag ashila. So thai ochunu we were divided into groups of two. Pura janal ghara ochunu tangela ullo chishila, and they were so happy. Tani white coats ani stethoscope galal jana padela, they are so happy. Puran bitar aponu, juice pionu, and they were very, very, very welcoming. So that ek nice feeling ashil community medicine ach. We were taken to dams where amka water treatment avishay ve shikchashila MBBS antu, sewage treatment, water treatment, everything. And one interesting case I would like to share when I was posted in the emergency department is, it was ratri 9 o'clock ashila. आणि some farmer from a very far away place came running आणि ताण म्हणली की snake bite, म्हाका एक snake bite केला. And he showed us the place, he showed us the site where the bite was, and he was very smart की ताण पुरा बांधू आणि पुरा मस्त तो तागेल पुरा first aid कोरून आयलेलो. Unfortunately, one very fascinating thing was ki to the plastic and tagel snake way घेऊन आयलेलो. And he came and he put that snake on the table and is like, idu how kachide, ನೀವು ಎಂತ ಮದ್ದು ಕೊಡ್ಬೇಕಂತ ನೋಡಿ. So there was full panic in the emergency department. The snake was alive, it was in the plastic, and then the security had to be rushed in pure. So weird patients we meet, very funny patients we meet, and it is, you meet so many people. Ek ward antu, you, if you have one patient, you have 5 bystanders, and if 5 bystanders are ek ek lala don teen question asta. So you meet hundreds of people, different people, and it is a very fun thing to do every morning. And then final year antu, of course, it is very, very, very difficult. Sleepless nights was munch badla. There are no nights at all when you're in your final year. So we have obstetrics and gynecology, we have surgery, we have medicine, and we have pediatrics. Along with that, orthopedics, anesthesia, radiology. So you have all these subjects in your final year. Very interesting, no doubt. And one important aspect that I would highlight here is that MBBS is not just about working hard, it is also about working smart. First, second year antu, okay, you have your books, tumi patients padai nachi, tumi ken padelar book vajita, that's all the information that you have. But third year and final year agel kudle, you go to the hospitals, and amgel main job hospital antu history taking. So एक patient येता, आणि त्या पेशंटान ओपीडी येताना आम्ही तागेल नाव निमगिताची, तागेल एज, फ्रॉम वेर इज ही, तो कसला हॉस्पिटल आयला, तागेल कसने पास्ट हिस्ट्री असवा, एके डायबिटीज, एके बीपी, एके कसने किडनी कंडिशन कसने असवा, मागीर ताक विंगड कसने कंडिशना खातीर फूड हॉस्पिटलाइज केला, तागेल फॅमिलींत कसने प्रॉब्लेम असवा, तागेल कसने एलर्जी हिस्ट्री अस, ड्रग हिस्ट्री अस, तागेल बायले कसने प्रॉब्लेम अस, अम्माक आनी अन्ना कसने प्रॉब्लेम अस. You have hundreds of questions to ask. And if a question to miss kelva, your professor is going to catch you there and grill you left, right, center. So to kenai this ki tu MBBS and to aja vajun chamkalya case ward ante dengue case ashila te dengue vishe vajun chamkalya madari, it is never going to happen like that. Tu kasa vajini, or the concept that you don't know, tu professor tu taj vishayu nimgita. And getting insulted and getting yelled at is one of the most common things that happens in the medicine ward. So medicine enter jatana, the first thing you have to do is please keep aside your ego, or please keep aside your anything. You cannot have self-respect in medicine, because probably that's how you learn. And there is so much to learn, nobody would go back and open your books. So that is one thing we are very grateful ki amgel professors ane korno aile tani, they have also suffered the same way, so they are making sure even we suffer. So everyday patients almak shocha, and that is one way of learning, because textbooks antuk itli information asa, it might not be necessary to exam baretana. So it is very line vajuj padla textbook antu. Always go to the ward. You can talk to your patients, go through their case files. Doctor's report monasta. तुगल doctor an कसा त्याच विषयी you comment केला. Doctor's report. We get to attend surgeries and we get to assist in surgery. San suturing. जाऊ एक साना इन्सिशन दिवचे कसने एक पस्त जाऊ असला ड्रेन करचे. So we get opportunities to do all of that. Beautiful surgeries we attend. Oral cancer surgery ashila, which was like, it is called a commando surgery. That 7-8 hours jauchi surgery for a general surgeon to do. And it is, that feeling is also different. You stand in the operation theater. Kello surgeons astachi. Then एक like per music घालणं असतं background अंतू, and based on that music त्यांनी vibe कोण तांकां surgery करता असताची. So kello surgeons are very, very strict. एक साना शब्द ऐकला that they'll throw all the nurses and students out of the OT. So you, like, you have different types of patients. You also have different types of doctors that you can meet in the hospital. So that is one thing. And pediatrics is interesting, but it is very, very annoying. Itamadari Cherdu, as cute as they are, but when kids are sick, they are the worst patients to have. Miguel pediatrics exam velari, the patient that I had got, that 1 second where to start karni. From the time my exam started, practical, till the time my exam ended, the 1 second with road rabbani, it was very difficult for me. And doctors are merciless. तुम्हाला तुगल patient रडतं, so he's not comfortable, मला that is your problem म्हणताची. So you have to learn to deal. Pediatrics avatana, amgel white quota pockets antu. We always have small toys. We have chocolates for them. But like age dependent factor. So the kid I got was 1 year old, and it was very difficult to handle him. Luckily, mak thode megal PGs alla support kella, and they helped me to examine him. Natla rav pediatrics sir main magirapa supplementary borokashal if it was my patient, if I was relying on my patient. So very interesting. MBBS's new cases you see. Unfortunately, Miguel, Ammani, Anu, they are very scared of the stories that I come back and tell. I'm getting a group of WhatsApp antu where I keep putting pictures of what I see, of the surgeries that happen, child delivery jalla, yes, C-section jalla, and all of that. Tani podoch put it delete konsorta. Like, please don't send it here. We don't like watching all of this. Mono. So in that way, my parents are very different from. But I have my mom's friends who are very interested. Tani mantaj tu mak petai, tu mak forensika vishay sanga, and all of that. So it's very interesting when people come up to you and ask you about what you're doing, and show interest as much as you have. It's very nice. So MBBS is not about only about academics. Samgal College had must festival asta. We have incredible professors. Amgal professors running race dukunu, cooking show dukunu, fashion show dukunu, dance performances. Purantu perform kartachi. So they are the very right examples of how to balance your personal and your professional life. So it is beautiful to learn academics as well as extracurricular from them. आणि मस्त कॉम्पिटिशन्स असताची अशें न्हय की तुमी कॉमर्स घेतलारी आणि इंजिनियरिंग केल्यार मात्र कॉम्पिटिशन्स म्हूण आमगेल्यान ते मस्त कॉम्पिटिशन्स असताची. Probably not as extracurricular as the other branches, but we do have quizzes. We have guess the diagnosis. Very interesting. To just take 5 sentences with touch about a patient, and you have to come to a conclusion about what probably could be the diagnosis. So it is very interesting, everything about brainstorming. So it's a very rewarding journey, I would say. And very happy to say कि Miguel MBBS, in 4 years of MBBS, I have 3 research papers in my name. So 2 research papers for which I am the author, and 1 more research paper and co-author. So my research paper is based on the topic prevalence of diabetes young students antu, because at the church pura students hostelites jau PG inta sachi, and eating junk food is very, very common. Even me, even in my house, even in my surroundings, eating junk food with Zomato, with Swiggy, with so many cafes, it's so common की आता young age तुझी diabetes is incidence is increasing. So ताजेर मेगल research topic असं. अनेक रिसर्च टॉपिक is what is the effect of using headphones. आता तुम्ही पळयताची पुरा जना कानांतू headphones, earphones, be it in the bus or be it by listening to classes, कसं ऐकताना headphones असताची. So तुम्ही सान एज तुकुनु at even younger kids who are 5th standard, 6th standard तांका वय earphones जाय. So what is the effect of using earphones from a young age and that तुमगेल्या hearing कशी significantly उणी करता is my research paper. So all in all, MBBS is a very beautiful journey. Many sleepless nights, lots of sacrifices, lots of hard work, lots of skilled work as well, because आम्ही वाजूची मात्र नाही. If you do not have skill, tuk IV galch kashmun gotna, tuk injection diuch kashmun gotna, tuk stitches galch kashmun gotna, then you are not fit enough to be called a doctor. So must the skilled work as along with the theoretical aspects, and it's a beautiful journey. And I am making an internship at Thursday, so after that I will be giving my NEET PG. So Megal NEET PG into, hopefully I'm praying to get a good rank, and I have two options in my mind, ek dermatology and ek obstetrics and gynecology. So hopefully I will get into the branch of my desire again through a government seat. आणि MD Jalmagiri, I am planning to do my MBA in hospital management. So hospital management MBA kelari, you get into the administrative section of a hospital. So that section angelari, you have good work-life balance. You can also practice, but you are more towards the administrative block. And I have been a girl who loves to organize things, who loves to take initiatives, who loves to plan things. So Magdastakita administrative section is well suited for me. So this is my plan, and very thankful and very grateful ki maki opportunity dilli to me to come and share my views. And I hope I've done justice. Tum sakdank, thank you. Hare Krishna.
Hare Krishna, Arun. Hare Krishna, ಭಾರಿ ಚಂದಕ್ಕೊಂದು ಡೀಟೇಲ್ ಆರಿ ಪೂರಾ ಆಸ್ಪೆಕ್ಟ್ಸ್ ಚಂದಕ್ಕೊಂದು ಸಂಗೊಂದಿಲ್ಲ ತುಗೆಲ್ಲ ಥ್ರೂ ಔಟ್ ದ ಜರ್ನಿ ಅಪ್ಸ್ ಅಂಡ್ ಡೌನ್ಸ್ ಕಸ್ಕಸ್ ಅಶಿಲ್ಲ ಫ್ಯಾಮಿಲಿ ಸಪೋರ್ಟ್ ಕಿತ್ಲ ಇಂಪಾರ್ಟೆಂಟ್ ತುಗೆಲ್ ಸೆಲ್ಫ್ ಕಾನ್ಫಿಡೆನ್ಸ್ ಪೂರಾ ಭಾರಿ ಚಂದಕ್ಕೊಂದು ಸಂಗ್ಲೆ ಅಂಡ್ ವಿ ಗಾಟ್ ಅ ವೆರಿ ಕ್ಲಿಯರ್ ಪಿಕ್ಚರ್ ಆಫ್ ವಾಟ್ ಇಸ್ ಆಕ್ಚುಲಿ ಹ್ಯಾಪನಿಂಗ್ ಇನ್ MBBS. So thank you very much for that. Bhari like kon sangle. Mast dhanyawad. And we can see it very clearly that you're very passionate and you're enjoying the journey. So that's a very good sign. Thank you very much for that. Bhari like kon sangle.
Hare Krishna, Arundhati.
Hare Krishna.
Mag दोन विषय कोळक आशिल्ले. First is you're telling NEET aspirant. Self-study NEET aspirant, how many hours a day do you recommend?
Self depends on tugel grasping power kitlas. Mak minimum self-study, what I took, repeat kartana, mak 9 to 2 o'clock migel akashach coaching astashila. And then I used to freshen up. 4 o'clock I've start kelari. I used to study for at least 9 o'clock to 10 o'clock. So basically, I would suggest 5 to 6 hours. But again, it depends, because normally Jan college jalli kudle, I mean, tangal normal day-to-day college kel magi NEET baretachi. So self-study, number of hours pashi chad, I would say consistency. Every day, even if you study for 2 hours, but you make it a point to study every day, I think you're going to be way far beyond people kon last moment the were no full day vajitachi.
Okay. Next, I would like to know, you talked about you should always have some backup plan. So what type of backup plan can you have when you are a NEET aspirant?
NEET as such is only for MBBS and BDS way. So lower ranks in MBBS mark medal 440. So 440 into, I would have gotten into a very good dental college. So where your MBBS ranks marks start coming down, to kuntugelle dental at top start jata. So that is for NEET. Next, if you are very keen on getting into medical side, must allied asachi. You have BPT, tuk physiotherapy asa, magir tuk nursing asa, And then you have hearing and speech defect touch doctors astachi, occupational therapy doctors astachi, anesthesia OT म्हणून असता, where you have to go and help the anesthesia doctors, the full OT setup korchantu. So there are various fields, but yapura fields antu you can go through CET. Basically, NEET antu you only get into MBBS or into BDS.
Okay. Thank you so much, Arundhati. आमका एक
Thank
all
you, thank you.
एक आमका knowledge gain केलं actually. Thank you so much. Because
Thank you, thank you.
at least I am not from this medical field, so Mastipura mak got nashile, and your experiences are very fascinating. Someday maybe we will have a second session with you. Hare Krishna.
Definitely, definitely.
Yeah, what you said is a very interesting. Even I feel that my daughter should have been attended this course because she also liked to see the body part. Okay, she's in 9th grade now, आणि ते सदांच म्हणटा की म्हाकाय डॉक्टर जावपाचें. पूण ताका हांव विचारलें की कसलो डॉक्टर जावंक सोदता तूं? So she said initially, no, I wanted to see the heart and all. So then I said, okay, maybe you can be a heart doctor. But sometimes she said, no, I wanted to see the brain also. So then you can be well, that was a little bit confusing. And but the way you said and the what you said, it's very interesting for all these people who are really interested to go to the medical field. Even though आम्ही काय medical field ना, but the way you speak, the way the encouragement which came from your parent. Actually, the first time when you came down, okay, so then you wanted to take a drop. तेन्ना तुवें सांगलें तुज्या पेरंटाक की आपल्याक ड्रॉप घेवपाचो आनी तुज्या पेरंटान तुका ब्लेसिंग दिलें. एक्चुअली दे सेड ओके, बट इनडायरेक्टली दॅट वॉज अ ब्लेसिंग. एंड आमच्या कल्चरान आसा पळय, सदांच कितें बरी गोश्ट करता जाल्यार आमी सदांच आवय बापाच्या पांयां पडोन वचोंक जाय अशें आमकां सांगता. आतां तो पडना तो वेगळी गोश्ट, बट दॅट वॉज आवर कल्चर. एंड द स्टुडंट हू डू दॅट, देर इज ऑलवेज सी, वी कॅन से 95% युअर एफर्ट, ओके, द 5% एक लक जाय म्हणटा. So that is how it like, 95 तू कितले एफर्ट घाल. समटायम कितें एक ब्लेसिंग ना जावं एक आशीर्वाद ना जावं देवाची कृपा ना जाल्यार सुद्दां समटायम वी फेस दिस डिफिकल्टी. And that is what you overcame the second time. Okay. So now what happened, everything we put together like our effort, but we don't see what is behind that. Okay. Everybody has to die. Okay. Certain age comes, everybody has to die. But then what is after death? Okay. So now you put so much effort, you came to this level, and now you're thinking, no, I wanted to go to the admin side. Okay, I wanted to do the MBA, and then, but then that you can do directly MBA and go to the medical college as a admin person. But the way you put your efforts, all these things, and definitely other point what you said, like see, when you treat any patient as such, आणि तो बरो जालो जाल्यार त्याच्या एक म्हणजे एक तो एक्चुअली हॉस्पिटलान येवप म्हणजे एक भंय आसता. आनी इवन आय विजिटेड हॉस्पिटल फॉर माय कझन्स ऑर समथींग, कोणाच्या पांयान हे सायडीन रॉड घातलेलो हँग करता, हें करता, ते एक भंय म्हणजे. आनी कोण इतलो बारीक आसता, तेजे पांय कट केला. आतां डायबिटीक जावन खूब जाणांचे पांय बोटां बी कट जाल्ले आसता. ते पळोवन एक फियर फॅक्टर तयार जाता. बट इफ दॅट फियर फॅक्टर रिमेन, then what is that fear factor? Okay, where we are going to take that fear factor? Because see, everybody has a fear of death. Okay, nobody can overcome that. But that is where the Krishna come in the picture. That is where the Krishna tells in the Bhagavad Gita also, right? But nowadays everything is modern. Even doctors sometimes they give up. Okay, you sign here. We are not responsible for your da. Okay, so patient don't know any what because there are so many points. So they have the faith on the doctor, but sometimes doctor also helpless. Then they also pray before starting the operation. Yeah, but they also depend on their master. Correct. So that is where the Krishna's role comes, and we have seen so many magic thing happen because sometimes doctor said. I never expected this, but how come this has happened? And then he was survived. And we saw so many things, but still. So there is some spiritual power which is acting behind the doctor, okay, or the patient. Because most of the, even now, if you see in our tradition, I don't know much about the Western, but at least when even it's a Catholic or Muslim or Hindu, in India especially, because India is a land of spiritual. So even when they go, they will put some tilak, whichever god they follow, okay, or they will start rosary. Means they have the faith on them. Okay, so that is also very important part, because if you see the Bhaktivedanta hospital, okay, they knows, okay, as you are an experienced doctor now, you knows, okay, this patient will lie, okay, maybe another 2 hours he will going to leave the body. So then the doctor said, okay, now okay, we have to prepare him. So they will try to put a Ganga Jal or Tulsi leaf, because that is very auspicious for his to transcribe from one body to another body. And as the Shastra say, 84 lakh yonis we have to transfer. Okay, after 84 lakh yoni, then you will get a human body. So till that time, we don't know what's going on. Where are we? Because once you leave the human body, you don't, because then it is a cycle, one after another, one after the human body, there where you have the intelligence and consciousness. So that is where you can break the cycle of birth and death. That is what mentioned in the scripture. And that is where Krishna comes in the picture. Even if you see, I was just reading, because I was given, when they told me that, Prabhu, you have to, okay, be present here and guide. But then I remember, if you see the third canto, I don't know whether you read it. Okay, third canto, if you see in the, one second, let me open. Okay, third canto, there is one nice chapter. I think you should read it. Okay, okay, that is the 31 chapter. In that, Lord Kapila, okay, Lord Kapila gives the instruction, because Lord Kapila was telling his mother. Okay, he was explaining. In there, he clearly mentioned this. And in ISKCON, what we do, any Mataji is getting pregnant, we tell them to read this chapter. This chapter is so interesting, okay? And Srimad Bhagavatam is not written by any person as such. It's the incarnation of the Lord himself, okay? So when Narad Muni, when he appeared, okay, and the writer, he was not happy with what he has written, everything, all the Vedas he has written, but he was not happy with that. And then when his guru comes, okay, he asked him, okay, so why is that happen? I wrote all the Vedas, I wrote all the Puranas. Still, I am not happy within my heart. Sometimes it happens, right? You're not happy within your heart. You think that I done the justice, but something happened which I cannot tell others. But I know that is a mistake which I done, but I don't want to share, because that is my ego. If I share, then blame will come to me. They will all that kind of thoughts process come in the mind. Okay, so but within the heart, you cannot cheat yourself. Okay, so that is where the Paramatma comes, because every body has Atma and Paramatma. Atma is ourself, Paramatma is the Lord Supreme itself. He'll guide you within. Sometimes we think that, okay, see that good that I have not gone to that bus. Okay, I was about to come, and then I feel, no, I don't want to go in that bus. And that bus met with the accident, and so many people died. And if I would have gone in that bus, I would have been also met in the accident, and something will happen to me. So sometimes that happens, incident. Who is that? That is the Paramatma within that. And that is where his role comes. See, as a doctor, you have very important role. Okay, that you have to cure the patient. That is a responsibility, because you went through the medical college, they full training, they train you, okay, very well. Okay, and it is not easy also. When you said you saw the 7, 8 dead bodies, even if you stand one dead body, we scared, right? See, even though if our आमचं कोणी तो इतलं even बरं मागतं असलं, even wife sometimes when husband died, okay, she will cry, or the children will cry, my father died. But if anybody say no, now okay, his son is there in the Europe, okay, it will take 2-3 days to come. They will allow to keep the body 3 days in their house? No, they will say, okay, do one thing, we will keep in the mortuary. Till that time, we will cry as a house, but the body will remain in the mortuary, because we are scared. Even though, because we think, we know that, oh, he is a Sunil Madhava, but he is not the Sunil Madhava, because the soul which was there is already left the body. Now that is only the dead body. When there is no soul, it's become dead. Okay, there is no movement. Okay, they will think, okay, he's my son and this and that, but if the night time comes, everybody's scared. Then they will call neighbor, can you stay with us for some time? And all this will start. Even though it is his own son or husband or the wife. Because when there is a soul is there, we are very okay. As soon as the soul leaves, then it's dead. And then we scared. So all that thing is there. But that's where the Krishna enter in your life. And we have to remember that. Because as soon as, when we realize that Krishna, okay, and when we give that responsibility to Krishna, then Krishna take over. And that is where the fear is not there. That's why you see there are so many stories we see in the ISKCON devotees, why all the foreigners are coming to India to leave the body. There are so many cases happening that they wanted to come to Vrindavan or Mayapur. They wanted to leave the body. And then they share their experience. Because as soon as, it depends upon your consciousness when you leave the body. That is what Krishna says, right? Antakale chamameva smaran mukti kalevar. So there where Krishna mentioned in Bhagavad Gita, at the time of death, whatever consciousness is you get the next body. But if you think about me at the time of death, then there is no other body for you because you come to my planet. That is Krishna Loka, right? So that is, we heard about this so many times. But even when people wanted to die, or everybody say, I wanted to go to Sarga, but nobody wanted to die. Because if you want to go to the Sarga, you have to die, right? They say, I wanted to go to the Sarga, but nobody wants to die. That is the common phrase used. That is how. But when we give the responsibility to Krishna, or we circle with the devotee, then there is no fear. And that is what happened. Actually, when my father, okay, he was about to leave the body, my mother came to know that he was going to leave the body. He was not very well, and he was bed rested and all that. And then my mother told my brother, then I think Bhagavata Purana, so we should prepare. Then he called all the devotees. They came, they did a kirtan, all that thing, and some devotees started reading Bhagavad Gita, kirtan, and he has no fear, and his face was like charming, and he just left, and nobody knows that he left the body. And then the devotee said, okay, nobody will cry, and that was like a different experience in our village. Actually, I'm from Goa and Sankling. And then what they did, then the devotees started doing kirtan, and then all the relatives started coming. And some of the relatives, they will cry loud and all, and oh, my brother, and this, he was so nice, and this and that. Yeah. But as soon as they enter here, now all the bhajan is going on. People are chanting sloka, so they don't know what to do, whether to cry or they to come. So they also all come, and then they started talking, what is this? We never saw like this kind of thing, where person is dead and they are doing bhajan, kirtan and all that. And for them, it's a totally different experience. But for us, it is a good thing. Yeah, because we, by the mercy of the Krishna Guru and all this Prabhupada mercy, we know how a person should leave the body. And that is what you see. Most of the ISKCON devotees or senior devotees leave the body. Their faces are glorious. There is no fear on that face. They know that, okay, I'm leaving the body and I have to prepare when I leave. And they know how to leave the body also. Because then they focus. Then they said, even I don't want my relative to come in front of me, because then I will cry. Okay, so I want to focus on the Krishna. So they will put the Krishna nice picture. The person, devotee will read Bhagavad Gita 15 chapters, or they will do kirtan. And then when they leave the body, if you see the faces, it's glorious faces. So that is what we have to always, even as a doctor, this is also your responsibility. I think instead of going for a management, you should be staying as a proper doctor only, where you can solve, because you put so much efforts in that. And now you learn everything. And now you're saying, okay, I wanted to go to, it is up to you. Because then I thought, like, why she has to do the management? If she wanted to do the MBA, she would have done straight MBA in hotel management or hospital management. There are so many direct courses available. After going to all these things, okay, so you actually, your job is service oriented. And a lot of people require the doctor who is really careful. Nobody likes the careless doctors, because they think, okay, you are the only, they don't, yeah, even though they pray, okay, to the Lord, but then they think my life is in so-and-so doctor's hand. And then even now my cousin, he just fell down. He was like 58 years. He fell down and he had a fracture in the backbone or something like that. And he was hospitalized. And doctor gave him the date. Okay, to so and so day we will do the operation. And then some emergency cases come, accident and all. This thing was postponed. So 3-4 times it happened. Then they called me. Then they called a relative. I think we should take some actions and this and that. Okay, so we called the senior doctor and then he planned. But even though he had a pain, but whenever the doctor come, he used to smile, and because he knows that only this fellow will going to help me out. And then he said, "No, I don't want to get the operation with that fellow. He's little crooked and he's shouting and this. I don't want. I don't know whether he'll do the proper operation or not." Okay, but when so and so doctor come, they speak nicely and all. They think that okay, this doctor is very nice, so he should do the operation for me. I mean, whether it is means he's completely giving himself on that particular doctor. Okay, so so it depends how you treat person, because what you give, what you get. So when you treat person, they will also respect you, and when they will leave, even they will feel no, I should not. Maybe I should stay one more day. So and so doctor such and I, they will thank you. They will bring you some bouquets or some gift in the return, because they feel that you are done the justice for them. Correct. So maybe this is also you might have experiences. It is, but nowadays even medical, the private is completely commercialized. They will not see whether you are really a rich person or you are really a poor guy, because they will see okay, within this doctor has a target to complete. Okay, this much this revenue has to generate, because we are paying for him the high salary. So he should, number of times he should get this revenue, and that time doctor also is bound to do that. Actually, if you see the doctor profession is service oriented book, because everybody is giving himself, all the patient is giving himself, like, okay, whether I will die or I will survive, it is in the hands of so and so doctor, kind of thing. Okay, this is part of the doctor, but then who is behind it? So that for that you have to read this chapter 31 and the third canto. Okay, I will just read one. That is a Kapil's instruction to the movement of the living entities. So there where it's mentioned how the soul, okay, get the next body, how it is developed, all the systematically. And this was written by Vyasdev. Okay, so this is there in Srimad Bhagavatam. This is there in the Purana. It's not written like, okay, yesterday somebody studied MBBS and he came and wrote. No. So this is there in our Shastra. If you see the shloka number 1, the personal Godhead said, under the supervision of Supreme Lord, okay, under the supervision of the Supreme Lord, and according to the last result of his last work. So I mentioned like earlier, like at the time of death, what do you think? Or what is your karma? So here karma is also acting. Now even our आधी आमचे जाणटे म्हणटाले पळय त्याच्या कर्मा प्रमाणे ताका फळ गावलें, because and now most of the people talk, oh, that is his bad karma only, that all this karma is coming now again. Earlier it was not there. See, even earlier people were sattvic. Okay, they were not fascinated. No, I want this mobile, I want that mobile, I want this. But that all gadget doesn't help you. It even degrade your thing. More and more if you use the gadget, as you said, the person who was using the more frequent headphones, that is what you did the study, right? So what happened to the end result? Because his hearing capacity is lower and down, correct? His intelligence also lowers now, because again the ultraviolet rays and all kind of these what do you call that that damage your brains, because the brains are minute cells, okay, where the blood and the prana is transferred, okay, through the oxygen only we get the blood circulation, right? What is circulating the blood is our oxygen, prana. That is what is mentioned in the Shastra. Is the prana means oxygen, and that goes through the minute nerves. Sometimes it so happen like if you have so much of pressure, work pressure or this thing, and then your blood pressure high, and then it triggers, and then you say, oh, he has a brain hemorrhage. What is that brain hemorrhage? We have so much pressure that if you see the pipeline, water pipeline. If you have so much pressure, sometimes the pipe bursts. It's a similar structure happening in our brain as well, right? But brain has such a tiny, tiny cells where all this, who has created that? Whose intelligence is there? Who is engineering that, right? The Lord Himself. And normally, if you see, even if you see, आमचे शास्त्राप्रमाणे, actually, if somebody has to born, there is a male and female is required, correct? But when Lord wanted to create the universe, He doesn't follow that rule. When he was Mahavishnu was on the Garbhodaksha ocean, then what is that? Okay, from his navel, the stream comes, the lotus. Okay, and who is created? Brahma, four-headed Brahma, not only one-headed. So he can do anything because he is beyond the laws of the nature, right? And from the Brahma, then he created all this creation, correct? And you have to read this interesting. You read so many books, whole whole house books. So these are the books when you read, it will give you the what is the force running behind us, and that will give you more encouragement to solve this oppression. Okay, and then your thought also will be the sattvic, because nowadays everybody talk about the sattvic because you yourself said everybody is eating the junk food. Okay, so instead of eating junk food, if you eat the dal rice or sambar rice, that make a lot of difference, right? But what happened? Our life has become so fast, so we don't have time for all these things. So whatever we get, just grab it and eat it and go. Like because we are getting more toward the animalistic nature of the life, because too much of pressure, everywhere is the pressure. If you go to the bus, train, pressure, we have to run, hospital timing, office timing, study pressure, everywhere pressure. Even when parent comes home, they also don't have time. Earlier, at least we used to sit together and watch the TV together. But now nobody has a time. Even children have their own mobile, they will watch whatever they wanted to watch. Nobody has control. So our life is getting more chaotic. Because as and when the Kali Yuga becomes stronger and stronger, all these things will happen. So we have to bring the Krishna in our life to cool down, come down, because we know that. Then when you read this scripture, when you become a part of the devotee circle, okay, as you part of the doctor circle, then sometimes you don't want to share the videos which are scary. So, but then our thought has come down. So one day you will realize that it's too much for me. I cannot take it. I cannot digest. It's too much of work pressure. Okay, I cannot do it. And then you wanted to come down. And then what you are going to do? Then you think, okay, let me go to the movie. You go to the movie, then you fed up of the movie. Then you think, okay, let me do the yoga. And that is where all this thing is coming. All the yoga. Yoga is what? Is also the part of the spiritual activity. So which will make you to come down to the sattvic level, right? There are different types of yoga. Even if you do the small Surya Namaskar or pranayam, that itself will bring you, and you yourself will know that, because as a medical doctor, you yourself will tomorrow tell, okay, try to do some pranayam, so it will reduce your this breathing exercise and all, which will give more oxygen to your body and all. So slowly, everything is coming back, right? Then sometime you'll think, okay, if I give you paracetamol or this thing that store more like a chemical, instead of that, okay, I will give you some, okay, so and so kada will be interesting. You take that. Yeah. So slowly we are coming to that level. Okay, so that is where we have to give the importance of the Krishna in our life. Okay, and when you read these kind of books, okay, as you as a student, even we was a student, we was passionate, but I saw your passion level was different. We was like a friend, okay, oh, commerce kar raha hai, so let me also do the commerce. That was our generation. Whatever friend do, we follow them. And then but everybody's karma, everybody's fate is different. My friend they did a commerce. They are some people in the government servant, some people in the private sector. I came into Dubai. So even though we studied same thing, but the result is different because as per our past karma. And that is where one day you remember this flight before Corona, the flight was, which was the flight? It was crash and a lot of people died together. Okay. So almost 250 people died in that flight. So everybody was talking about the flight, that flight particularly. How come 250 people died? No, okay. And then that topic was very hot kind of thing that particular time. So we had one Maharaj came in Dubai. So even we asked Maharaj the same question. Maharaj, how come 250 people died in that? Then he gave the right answer. He said, okay, there are different people has different activity, different karmas. Okay. So the person who has a similar kind of karmas, they all put together in that particular flight. And it was crashed. The result means punishment was the same for everybody. Even the punishment was the same for everybody, but the result will be the different, he said. And that is what happened. So everybody was in that flight. The flight crashed. So many people died. But the result will be definitely different because that particular flight, people might be knowing, okay, this flight is crashing. So a pilot might announce it. So some people might have said, okay, they might have taken the name of the Lord Shiva or Gadpati or whatever it is. Some people might be just crying. Some people must, oh my God, away, Amarta, right? So different activity, different action will be there from the different, or some people will just take the rosary. There's Catholic people, they start rosary. Muslim, they will say Allah, Allah, whatever it is. Or some devotees there, he would have taken the chanting, but he started chanting Hare Krishna Mahamantra. So different people, even though got the same punishment, but the result at the end will be different. That's what Maharaj said. Because that particular time, what was the conscious when he's dying? If you take the name of the Krishna, he's going back to Godhead. If you take the name of the Shiva, he's going to the Shiv Loka. If he said away, we don't know where it will be going. So as per the based on his past karma, he will be given the result. Okay. So sometimes we say why the good people suffer more than the people. Now people, they are enjoying more than devotee. Devotee always suffer all this. No, we are not suffering. Actually, we are preparing for our next life. Whether we want to go back to Godhead or maybe the best thing, even though if we are not completing in this cycle, at least we will get a human form of body and we can complete the next cycle and we can go back to Godhead. That is the result of the Krishna consciousness. And that is what we learn. Even doctor, I saw so many people, they said, okay, we are taking, but it's not in your hands, just try to pray. Doctor clearly say, if it is curious, like heart patient and brain surgery or so, they will say, because nothing in our heart, because there are so many tiny, tiny nerves, we have to cut all these things. It's very difficult for a doctor. That time he says, you please pray, okay, we will try ourselves, whatever is to be done. That is what. So we have to give the place in the Krishna in our center to cool down. Okay. So I think a lot of students or parents were here. They also came to know like how we can go for a medical field and what are the efforts and what are the hard work we have to do. But at the end, we should not forget the Krishna. That is my conclusion to you. And if at all you get the opportunity, maybe you can go to the Bhaktivedanta hospital, try for 1 month. How they are also doctor like you, but how they are different from you. You can definitely experience that. Okay. So when they know, like you as a doctor, you know, like, okay, this patient maybe live for another 2 hours. So how they prepare him to not to take the body again. So these are the things we should experience. And maybe you like it, maybe you don't like it, but at least we should go to the another step, higher step, or what you call. Yeah, and definitely I will request you to read this chapter 30 from the 31 from the Canto 3. Okay, there are interesting things, and definitely you and then you put your comments. You will whatever you study, no, it is already there in our Shastra. I'm not talking something blindly. It is there in our Shastra, and that is where even when mother eats some spicy, what is the effect the children gets? Everything is mentioned there. So it is very realistic, interesting. So slowly, we have to come to that platform because one day, even you are a doctor, even this thing, you will also get frustration. You will get also, but then what is the result for that? What is the solution for that? Okay, that is what is mentioned in our scripture. So we have to simultaneously do the both thing, and finally you are also soul. Okay, you cannot say, oh, I am doctor, means I can fly, I can go to the three loka here and there, I can go to Swargaloka. No, finally you also has a human body, you also has a soul, and you have also Paramatma, which will guide you. And he was guiding you. Otherwise, you would have not taken this kind of decision because you also had changed. Okay, I wanted to join these institutes. No, I forget this now. I wanted to join another institute. Who was guiding you behind? You was a passion, but who was guiding behind that? That is your Paramatma, right? And with the blessing of parents, you achieved it. So we have to keep that instant. That is my conclusion. Sorry if I made any mistake or if I over enthusiastically talk something which you don't like, because now youngsters are totally different than what we think, right? But we have to give some space. And that is, we have to rely on Krishna. Even nowadays, I have so many problems. But when we depend on Krishna, at least it's lower down. No, that fear factor is coming down. Or you relieve. Otherwise, people don't know they suicide. Why they suicide? Because they don't know. Even in our scripture mentioned that if you suicide, you will get a ghost body. You will remain as a ghost. And it's better to live as a human body, the human body with the facing so many problems, than become the ghost and then depending on some other body to fulfill your desire. No, that is what happening because people don't know. They don't read the scripture. They don't understand. That's why they suicide and then they become ghost. Because if that is what happening nowadays, when the exam comes, so much of pressure and on the children, students. Sometimes they think, okay, medical, like you said, I supposed to get so much mark to get this, and then if you are not getting, at least you said, okay, I will take a break and I will achieve again. But there are some students, they will think, my parent has taken so much of loan. Now what happened? I'm not getting the seat in the medical. What should I do? They kill themselves because nobody is there to guide them. That is where the devotee comes. That is where these scriptures come. How to control yourself, how to bring the stress. Okay, you are lucky in that matter. Your parents were supportive. But there are so many children, they are not lucky as such. Because we think the goal, we run behind the goal. If it is not achieved, then it's finished. We think it's a finish. We spend so much money. My parents done so many things, and I don't know what to do, and then they kill themselves. That is what happening in now because there is a peer pressure. There are too much of peer pressure now. And education system also is, especially in Indian education system, is stressful. Either you buy hard or you do this thing, and then people they cannot afford to do that. Then they start copying. Then the teacher caught. Then they don't. Then they say, "Oh, I'm caught. Now I cannot go to the class. How I can show my face?" Then they try to take either they drop out or they try to take a drastic steps. So all these things is happening nowadays. So we have to careful. When we rely on the Krishna or the Supreme Personal Godhead, okay, Lord, I have tried myself. Now it is up to you. Whatever you give, I'm okay with that. And that is what Kunti Maharani did, right? If you see Vasudha case, these are the stories actually we should share with our children or the relatives whenever we talk. And this will going to help at the time of whatever pressure you have. Like Kunti Maharani, everybody was there. Okay. And then Bhim was such a powerful person. Okay. Yudhishthir Maharaj, Dharmaraj, what we called. Okay. Arjuna was there. Powerful. Everybody was powerful. But what was the stage of Kunti Maharani? Okay. She called everybody. Then even Bhishma Pitamaha was such a powerful person. Did he help her? No. Like nobody helped her. What she realized, now these fellows are crazy demons. Okay, they are ready. And then what she realized, now I know that nobody will going to help. And, and then she raised both the hand. Okay, Krishna, now you are only going to help me. And she cried for him. And then Krishna immediately he put the factories of cloth. This fellow was pulling the saris, they got tired in factory. And then later on she asked Krishna, Krishna, you was there with us for all the situation. When they was doing Vastraran for me, okay, I was crying. I was remembering, but why you didn't call? What Krishna said, you was calling, he was trying, but you were still holding your sari that you can do. Okay, you were still holding. As soon as you raised your both the hand and called me, I was just one step ahead. And I just came for you running. Because Krishna was just standing outside the door. That's what he said. I was just one step away. So I was just waiting when you'll call me because I was seeing that and I was knowing. But I was waiting when you're going to call me and I will come to help you. Okay, that is what the Krishna is. There are so many stories. We don't have much time. Okay, if you see elephant, what I was forget that.
Hare Krishna, Prabhuji.
Yeah, Sorry. Okay.
Thank you
So
so much, Prabhuji. Like Arundhati spoke so well, but you have given a Krishna conscious angle to that, and you have brought in the topic so beautifully. Thank you so much, Prabhuji. It was wonderful, actually. Wonderful. And all our children should actually listen to this. I mean, how we like spiritualize our life. That is what you have shown us today. Thank you so much for this, Prabhuji. Thank
thank you.
you. Hare Krishna.
All right.
Swati, please. We couldn't introduce you properly. So, Swati Mataji, if you could just give Prabhuji's background.
Sure. Yes.
Mataji is okay. I'm also like practicing devotive, like.
So our audience also should know what is your background also. So, just for our purification, Prabhuji. Hare Krishna.
Hare Krishna. Prabhuji, thank you very much, first of all. It was a very, very enlightening and lot of take-home points. So, तुम्ही भारतचंद्र कोण सांगलाय की medical knowledge, it is just the material part of it, but spiritual knowledge it becomes a complete whole. So, Bharichandra कोण तुम्ही सांगलाय, there are too many things if I have to summarize. मस्त like information दिल प्रभुजी, मस्त धन्यवाद तुमका. हा एक साना रीते तुमगेला इंट्रोडक्शन दिवचा प्रयत्न करता. His Grace Sunil Madhav Prabhuji hangela karmik nama Sunil Monsangonu Hani His Holiness Bhakti Vikas Swami Maharaj hangel Shishya Jaunasati Hani ISKCON 2002 to join Jalilinti and hangel initiation 2010 anjarala hangel major seva malari audio visual management for all ISKCON DDY programs Damodar Desh Yatra programs आणि कीर्तन सर्विस आणि preaching करतात Hani well supported by Her Grace Rasangi Mataji. Hangella Charadua Bhakta Rishikesh and Bhaktin Bodhini Monsangonu. Hangel mission Malari Pracharani book distribution Korche. Prabhuji kasane Sangelanchu Kesleksham Korka and Masta Dhanyavad Prabhuji. And I would just like to add ki tumi Bharichandra Korno Sangla ki Bhagavatam Mantu third canton to ek chapter Vajoka Monsangonu. So Makta 31. 31, yes. So,
Lord Kapila's instruction to the movement of the living entity. That is the title.
Very interesting aste because in that chapter, I think it was that chapter, I don't remember exactly, but tantu mast details on at which month of the birth of the baby, kanchi month antu kaskasa develop jatpon bhari clearly asa. Because today we think that only through sonography we get to know all these things. This was written thousands of years back, but still all this knowledge was available. There was no, sonography, X-ray, nothing, but still all this information is very detailed and nicely mentioned. So definitely, I think.
Yeah, actually, if any pregnant woman, Mataji is okay, if she read this, she herself will going to realize, okay, now I am getting the movement over here. Okay, maybe because when I read it, okay, this movement was already mentioned. So this is what happening. Maybe the years are coming to my child now. So you read this and you yourself can apply in your life, then that realization will give much more power. And then itself again, because also it is mentioned when if you eat bitter things, when you eat spicy things, what is happening? It's clearly mentioned there. So then you yourself can take a precaution instead of eating too spicy. Maybe I can eat a little sattvic dal or something. So that will help my child because mother is having motherly affection, towards the child. So if she knows what is good for my child, she will try to do that. So that is what is mentioned here. So all the mothers, pregnant ladies should read this. So they get all this information in hand before. And this is spoken by the Lord Kapila. So his blessing is nothing like. Sorry.
Hare Krishna Prabhuji, मस्त धन्यवाद वापस तुमका. आता मी एक राउंड चॅन्टिंग करूया. चॅन्टिंग करू का आमगेलोटासाठी लीड करू का प्रतीक्षा भट. हरे कृष्णा प्रतीक्षा, over to you.
जय श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर श्रीवासादि गौर भक्तवृंद. हरे कृष्णा कृष्ण कृष्ण हरे 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 राम 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 हरे हरे. हरे कृष्णा कृष्ण कृष्ण हरे हरे राम 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 हरे हरे. हरे कृष्णा कृष्ण कृष्ण हरे हरे राम राम हरे हरे. हरे कृष्णा कृष्ण कृष्ण हरे हरे राम राम हरे हरे. हरे कृष्णा कृष्ण कृष्ण हरे राम राम हरे हरे. हरे कृष्णा कृष्ण कृष्ण हरे हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम राम हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, हरे राम 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 हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्णा कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम 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 हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण कृष्ण हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, हरे कृष्ण 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 हरे हरे, हरे राम राम हरे हरे, जय श्री कृष्ण चैतन्य प्रभु नित्यानंद, श्री अद्वैत गदाधर श्रीवासा